So this is the AURORA study, and it is a early phase study, a first in man study using a flexible microwave ablation probe that is delivered with the ion robotic bronchoscopy platform. So microwave ablation has been historically used percutaneously to treat patients with early lung cancer or metastatic nodules in the lung, or patients with metastatic nodules in the lung. Microwave ablation causes frictional heating by polarizing water molecules, and that causes a homogeneous zone of thermal ablation to target nodules. Patients who have had this done percutaneously are at risk of complications such as pneumothorax, but potentially using it with a robotic platform may allow for lesser complications. The AURORA study will be looking at patients with early lung cancers and patients with metastatic nodules, and will be using a flexible microwave ablation probe to treat those patients who are not suitable for surgery or radiotherapy, or who have chosen not to have surgery or radiotherapy treatment.